Tonight, we're taking a closer look at the flu versus COVID-19, specifically in kids. KSBY News reporter Alexa Bertola talked with a local pediatrician about what parents need to know.
In order to prevent a twindemic of COVID-19 and the seasonal flu, health experts are recommending that you get your flu shot now. In the midst of a pandemic and flu season looming,
we generally recognize it anywhere from September to March each year.
Local pediatrician Dr. Renee Bravo is prepping for what's to come.
I expect as the winter progresses and more schools and businesses open up, that we will see a natural increase in the number of COVID cases that we see.
Dr. Bravo says over the past 6 months, he's seen a number of kids who have tested positive for COVID.
Most of them have been identified only because the parents were ill and the children were tested because of the parents' exposure. And I have seen these, followed them along, and they've done very, very well.
We haven't felt super concerned about the kids getting hit really hard, and we don't have underlying conditions.
According to data from San Luis Obispo County Public Health, 3 kids under 17 years old have been hospitalized for COVID-19. Last flu season, there were 15 deaths among individuals 18 years and younger in California, compared to 17 deaths the season before, according to the California Department of Public Health. That's compared to 2 COVID-19 related deaths in kids between the ages of 5 and 17 so far this year in the state. Dr. Bravo says the biggest difference between the flu and COVID is the timing. The flu comes on within 2 to 3 days, whereas COVID is more gradual, meaning symptoms can appear up to 15 days from exposure.
Most of the time, what I hear from people and patients is that they lose a sense of taste and smell with the COVID disease, whereas that's not as common with the flu.
With COVID, a fever is milder than with the flu. A headache and extreme fatigue is more common, but a runny nose, a cough, and congestion is more vigorous with influenza.
My biggest concern is not being able to distinguish between people who have a common cold, people who have the flu, and people who have COVID. Because in the earliest phases of these diseases, sometimes they're indistinguishable.
We're just kind of taking it one day at a time and hoping that we'll stay healthy.
Dr. Bravo says you need to be 6 months or older to get a flu shot. In San Luis Obispo, Alexa Bertola, KSBY News.
And 1 in 3 parents in the U.S. plan to skip flu shots this year for their kids. That's according to a new University of Michigan poll out today.